a life-saving discovery: the power of blood transfusions. This medical breakthrough has been a cornerstone in the field of healthcare, providing a critical lifeline for patients in need. Blood transfusions, a cornerstone of modern medicine, have revolutionized healthcare. They have become an essential procedure in hospitals worldwide, offering hope and extending lives in ways previously unimaginable. This life-saving procedure has dramatically improved survival rates for surgeries, traumas, and various medical conditions. From emergency rooms to operating theatres, blood transfusions are a critical component in patient care. Before its discovery, countless lives were lost due to blood loss and related complications. The advent of blood transfusions marked a significant turning point in medical history, transforming outcomes for patients who would have otherwise faced grim prognoses. Today, blood transfusions are routine, saving millions annually. They are used in a variety of medical situations, from treating anemia and cancer to supporting patients undergoing major surgeries. However, like all medical interventions, they are not without risks. Potential complications can include allergic reactions, infections, and issues related to blood type mismatches. Balancing benefits and risks is paramount. Medical professionals must carefully evaluate each patient's condition to determine the necessity and safety of a transfusion. This involves determining the optimal timing and amount of blood to transfuse. Precision in these decisions can significantly impact patient outcomes, ensuring that the benefits of the transfusion outweigh the potential risks. For decades, a transfuse at higher hemoglobin levels approach was standard practice. This method was based on the belief that maintaining higher hemoglobin levels would enhance oxygen delivery throughout the body. This strategy stemmed from the belief that maintaining higher hemoglobin levels would improve oxygen delivery and prevent complications. However, this approach was not without its drawbacks and potential overuse of blood products. However, emerging evidence began to challenge this long-held practice, paving the way for landmark clinical trials like TRICC. These studies have provided new insights into the optimal use of blood transfusions, promoting more conservative and evidence-based approaches to patient care. If you found this video informative, please subscribe to our channel and give us a like. Your support helps us bring more valuable content to you. Thank you. Challenging conventions, the TRICC trial and its findings. The Transfusion Requirements in Critical Care, or TRICC trial, a landmark study published in 1999, challenged conventional wisdom on blood transfusions. This large, multi-center, randomized controlled trial sought to compare the outcomes of two transfusion strategies in critically ill patients. The restrictive strategy involved transfusing blood only when hemoglobin levels fell below 7 grams per deciliter, while the liberal strategy aimed for a higher threshold of 10 grams per deciliter. The TRICC trial's findings were groundbreaking. Surprisingly, the study found that a restrictive transfusion strategy was not inferior to a liberal strategy in terms of 30-day mortality. In fact, for certain patient subgroups, such as those with stable cardiac conditions, the restrictive strategy was associated with better outcomes. These findings sent ripples through the medical community, prompting a re-evaluation of traditional transfusion practices. Historically, blood transfusions were often administered liberally, with the belief that higher hemoglobin levels would invariably lead to better patient outcomes. However, the TRICC trial provided robust evidence that this was not necessarily the case. The trial's methodology was rigorous, involving over 800 critically ill patients across multiple centers. Patients were randomly assigned to either the restrictive or liberal transfusion strategy, ensuring a high level of scientific validity. The primary outcome measured was 30-day mortality, but the study also looked at secondary outcomes such as organ dysfunction and length of ICU stay. The results were clear and compelling, showing no significant difference in 30-day mortality between the two groups. This was a pivotal moment in critical care medicine, as it suggested that less aggressive transfusion practices could be just as effective, if not more so, for certain patients. The implications of the TRICC trial were far-reaching, influencing guidelines and practices worldwide. Many hospitals and healthcare systems began to adopt more restrictive transfusion protocols, leading to changes in clinical practice. The trial also sparked further research into transfusion practices, encouraging scientists to explore optimal strategies for different patient populations. Today, the TRICC trial remains a cornerstone study in the field of transfusion medicine, continually cited in research and clinical guidelines. Its findings have stood the test of time, underscoring the importance of evidence-based medicine in improving patient care. As we continue to advance in medical science, the lessons learned from the TRICC trial remind us of the value of challenging established norms and continually seeking better ways to care for our patients. The TRICC trial and its findings have undoubtedly left an indelible mark on the landscape of critical care, shaping the future of transfusion practices for years to come. Beyond the surface, understanding the TRICC trial's limitations is essential for informed clinical practice. While the TRICC trial provided invaluable insights into transfusion strategies for critically ill patients, it's crucial to acknowledge its limitations to apply its findings appropriately. The study primarily focused on critically ill patients, which means its findings may not be generalizable to other patient populations, such as those in non-critical care settings or with different medical conditions. Additionally, the trial did not account for individual patient factors that could significantly influence transfusion decisions. Factors such as age, comorbidities, and bleeding risks were not thoroughly considered, which can vary widely among patients. Furthermore, the TRICC trial primarily focused on short-term outcomes, such as immediate survival rates and ICU stay durations. This leaves many questions about the long-term effects of restrictive transfusions unanswered, including potential impacts on quality of life and long-term survival. Misinterpretations of the trial's findings also arose, with some clinicians adopting an overly restrictive approach to transfusions without considering individual patient needs. This can lead to suboptimal patient care and outcomes. Recognizing these limitations is vital to avoid misapplying the trial's results in clinical practice. By understanding the context and constraints of the TRICC trial, healthcare providers can make more informed decisions that balance the benefits and risks of transfusions for each patient. It's important to integrate the TRICC trial findings with other research and clinical guidelines, considering the unique circumstances of each patient. This holistic approach ensures that transfusion practices are both evidence-based and tailored to individual patient needs. Ultimately, the goal is to improve patient outcomes by applying research findings judiciously and thoughtfully, always keeping the patient's best interests at the forefront of clinical decision-making.